In case you don't know, I will share with you that Pat was hired as a ward clerk on April 13, 1990 by Rose Brandow and Dolly Cordell, two pretty good folks, I think. Okay. She transferred in February of '91 to First Medical, and then she transferred to, where's Lynn? In 1999 with the Cancer Registry Program, and worked with Lynn for a period of time. She also continued to float, and I know the nursing staff was very happy that she continued to do that as a ward secretary, if you will, for the number of floors. And then in August of 2009, she transferred to the Food and Nutrition Department and continued there until she retired. Well, her last day was about, 11 days ago? 12 days, something like that, or so. And she did a great job in our Food and Nutrition Department. I'll let Stacy make more comments about that.
But looking at Pat's personnel file, just as her short little tenure, 2-year pretty much here in our department, some things that the staff said about her, just out walking around the department saying, you know, what do we miss about Pat? And they said her positive attitude, really miss that. Patients miss her friendly voice on the phone. She worked in our diet office, and she was our room service clerk. And she had to handle 3 phones at one time. But each time she answered the phone, she was the most pleasant person on the other end of that phone, and put that patient first and all their family's needs and everything, and did whatever she could to get that patient what they wanted at that time, and made them feel like they were the most important person at that time, which is hard to do, you know, in juggling 3 phones. And also, she put on a different hat, and she worked in our dish room. So she went from one job of sitting down and answering multiple phone calls to running around like crazy in our dish room and passing trays to our patients, doing room service. So she got to see both sides of the story when you answered the phone and how it followed through to taking care of the patients. And she did such a great job on the floor. She had such a good rapport with all the nursing from working here over the years, and definitely with the patients. Every time she came downstairs, if a patient wanted something or needed something, she definitely went above and beyond and got that patient what they needed and putting them first. So that's just truly special. And I know many days she walked out here and said, I'm never doing a dish again, or I'm not doing dishes tonight, I can tell you that. Definitely the dish pan hands after you walked out of here, because it's a definite tough job. But Pat really shined, and she ran circles around some of these kids definitely at night. So she put them to shame, definitely.
Stacy asked if I would say a few words about Pat because she worked with me for 10 years. When she transferred to oncology in 1999, I didn't know it, but it was with a little fear and trepidation on her part. She said, I'll never learn that. She didn't tell me that till later. But she did, and she did a wonderful job with keeping up all of the information that we have to put into the cancer registry. Answering questions when there were questions to be answered, sometimes even by me. She would tell me some things that really helped me in my role in trying to complete cases or different things that we would do. One of the things that I think was so neat is all the way through, I read pleasant, flexible, always willing to work extra hours. In fact, one time, several years ago, we were asked on our employee performance appraisals, I think it was a survey that we did, Jim, for silent heroes. And she was listed as a silent hero, and that was by your peers. It was kind of interesting during her evaluations because I always had to get input from all these other people that she had worked with. And so I looked back and I had some comments from the different nurse managers all over this building because of this particular delightful person in all of the places that she was willing to go and help out. I'm going to miss you. If you ever want to come back and volunteer, I think we could find several places for you in this organization. Right, Ginger?
Right there in her.
But thank you for your assistance in helping to get the cancer program where it is today. And I really mean that.
Present you with this certificate of appreciation presented to Pat Millwood for 21 years of dedicated service to Rutherford Regional Health System. So thank you so much for your years of service.